So Novo Nordisk, the other big pharma in the GLP-1 space, is suing Amble. Amble is a telehealth company in this space, and it's over trademark infringement. So let's go through this case. They start out talking about they have been around for a long time, 100-year-old company. What is semaglutide? It's something they developed, they did clinical trials on. They have the injectable, the pill form, and they did all of that. So that's how it starts off. We get into Novo is the only company FDA approved to sell semaglutide in the United States, the ones that they have. The FDA does not approve compounded medications. That's said multiple times in here, and that is true. They don't approve it, but they do allow for compounded medications for shortages, in which all these companies got started because of the shortage of GLP. There's another line here, number 8, that I want to highlight. The defendant markets and sells patients compounded drug products that contain semaglutide, and they call them GLP-1s. So that's a really interesting line of like what people can label and call things. Line 9, the semaglutide products sold by the defendant are mass produced. We're going to see a couple screenshots from the Amble website next that talk about it being personalized medicine. So they have this. This is from their website, personalized GLP-1 injection. They also have why personalized GLP meds, personalized, tailored to you, all of this from their website. And they go through here to say all the ways it's not personalized. It's actually bulk made, and patients receive the notice that they're approved super quickly. I think they're hinting at that like a doctor couldn't actually review it in that amount of time. I think that's what they're getting at there. But this is good stuff to consider, like what is personalized medicine and what's allowed and what's not. Another key line to point out, 61, rather the defendant prescribes patients with standardized dosage plans for its unapproved drugs, which mimic the dose schedule for FDA-approved semaglutide. The other interesting line in here, number 41, the FDA has received reports of adverse events and hospitalizations related to overdoses from dosing errors with compounded semaglutide. So that's also interesting that that's in here and that they're pinning that on Amble. From the Journal of American Pharmacists also highlighted that patients were frequently or were accidentally self-administering the wrong amount of semaglutide. So I think this line is a good line for us to consider what is truly personalized medicine. What does it mean? Number 66, they're saying false advertising claims and misleading statements are causing a depletion in the marketplace and mistakes and things like that. So what do they want out of all of this, you might ask? They want a bunch of money. They want a bunch of money for the lost revenue. They want a ton of money, and they also want them to stop producing. That's what they're asking for here. It's going to take them a little bit of time to have the first meetings and conferences with the lawyers to schedule everything out. So this is definitely months away before anything actually happens. Today also is, ironically, May 22nd, which is the extension deadline for compounders to stop. So it is a big day in the semaglutide GLP-1 space. We're going to keep covering this. Let me know if you have any questions in the comments.